You will see this afternoon a new face with me up here. I'd like to welcome Dr. Philip Chan. He is an infectious disease specialist who's been a leader in the Department of Health's efforts from day one. And I have asked him to come with us this afternoon. He's going to make a specific presentation about vaccines and what Rhode Islanders can expect as it relates to vaccine distribution in Rhode Island in the coming weeks and months. Also, Dr. Chan will be hosting a Facebook Live tomorrow at 1:30 on the Department of Health's Facebook page, and that will provide additional information about the vaccine. So I would encourage you, please, to tune in, and I want to thank you for all you've done from day one and for joining me this afternoon. Okay, so we'll begin, as I always do, with the data, and it continues to be a sobering picture. I'm not going to sugarcoat this. It's getting scary in Rhode Island, and don't take it from me, just look at the facts. This is an alarming picture. So yesterday we had 948 new cases out of 13,600 tests for a percent positivity of 7%, and very sadly, we also had another 14 deaths. And as these cases continue to rise, we know we will see continued increases in hospitalizations and continued deaths that follow. So my heart goes out to every single family. We've all lost loved ones in this crisis. We continue to lose Rhode Islanders every day, and my heart goes out to each and every one of you who are struggling to get through this pandemic. In the weekly data, you'll once again see 3 red arrows, not what we want to see, with a percent positive up to 8.9%, new weekly hospitalizations up to 427, and new weekly cases per 100,000 up to 846. On an average day now, a typical day, we are seeing more than 60 people admitted to the hospital. That is more than we've ever seen, much more than our peak in the spring. 2 days ago, we had over 70 people admitted to the hospital in a single day with COVID-19. You may have seen that Rhode Island is #1 in America for cases per 100,000. That is not a distinction that we want to have. That is not where we want to be. There's a lot of reasons for that. We have the highest rate of testing in the country. We have a very dense population, a lot of multi-generational homes, and we are an older population with a lot of more folks per capita in nursing homes. But having said all of that, there's no excuse for it. It's not a distinction we want. And it's pretty simple why it's happening. People continue to not follow the rules. And as a result, more people are getting sick, more people are dying, more people are losing their jobs. Nationally, yesterday in America, we saw more than 3,000 deaths in a single day. That was the first time ever, as a country, we broke the 3,000 deaths in a day mark. So it's scary. It is scary. It ought to be a wake-up call for folks out there that still think it's not real, still think you don't have to wear a mask, still think they can sneak around and not follow the rules. I just want you to know that these data should be scary to you. But here's the thing. You have the power to protect your household. That's my message today for the people of Rhode Island. Do what it takes to protect your household. The power to protect your household is in your hands. And actually, it's pretty simple if you just follow the rules. And I'm going to go into that in a few minutes. The question before me today is, should we extend the pause or end the pause? And I'd like to share with you how I'm thinking about that. As I've said over the past few weeks, mobility data a measure of how much people are out and about, is a key indicator of cases. If people are out and about and on our roads a lot today, then we know we'll see more cases in a couple of weeks. If mobility is down today, we know that the cases will be down in a few weeks. I ask you please to put the slide up around mobility. There is some good news in this slide. The data is starting to trend in the right direction. So as the graph shows, the 14-day average of mobility in Rhode Island since September 1st, as you'll see, between September 1st and September 8th, we started to see a big uptick in mobility. Summer ended and people started to get back out and about, and then we saw an uptick in our data. You'll also notice the mobility spiked again around the end of October and early November, which again correlated with a larger uptick in cases a few weeks after that. But here's the good news. As you can see in the slide before you, the data has been moving in the right direction since about November 25th, which is right before we started the pause. And since the pause began, you see a steady decline in mobility. That's a good sign. If mobility continues to decline like that, it will almost certainly be true that we will start to see cases decline. In the last 2 weeks, we've seen 2.7 million vehicles on the road in Rhode Island, which represents a 12% decrease from the previous 2 weeks. So what that means is people are following the rules, and you should too. You should stay home. You should reduce your mobility. And if we do that, we'll get ourselves back on track. Having said that, it isn't the level that I had hoped to see. I had hoped to see, after the pause, a more precipitous decline, a quicker decline in the data, and we're just not seeing that. Hospitalizations are, of course, a lagging indicator, but we've seen no decline in hospitalizations, and we haven't seen a real significant decline in percent positive since beginning our pause. And as I said, there is a decline in mobility, but not as much as we had hoped to see, and we're definitely not seeing the decline in positivity. So because of all of that, and because we have, as I said in the beginning, pretty scary numbers with very high case numbers, I'm announcing that we're extending the pause for 1 more week, ending on Sunday, December 20th. So the pause will not expire until Sunday, December 20th. 1 more week of the pause. If we continue to stay at home as much as possible for that week, for next week, I believe it will have the impact that we need. Again, you see the mobility data, it's going down. You see a slight decrease in the percent positive. I just reported 7%, it had been 10%, but it's not enough to stop the pause. So let's keep at it, let's stick to staying at home and honoring the pause for 1 more week. Now, as I say that, I can hear in my own mind the collective groan of businesses who are really getting hurt by this. And I'm sorry. It's really hard. It is a hard decision for me to make. I am certain it's the right one to make in light of every piece of data I have before me. But I know it's brutal for you to hear that you're going to be closed or curtailed for 1 more week. I will say I've spent every day since I've been governor trying to improve our economy, and to have to throttle it back is especially painful. Having said that, I am announcing today that I'm going to extend the business relief for the 1 more week that we're in the pause. We've already received applications from more than 1,800 businesses, and we'll be mailing out the first round of checks for just over 500 businesses, totaling $10 million tomorrow. And in recognition of the 1-week pause, I have 2 more announcements about the program. First, we're extending the deadline to apply until midnight on Monday. So if you're one of the businesses that's affected by this pause, you haven't yet had a chance to apply, we're extending the deadline. You have until midnight Monday. It is a very easy application. It's very simple. Go to tax.ri.gov, tax.ri.gov, check a few boxes, and we will get the check on the way to you. If you want some more information about that program and how to apply, tomorrow at 11 o'clock, the Commerce Department is hosting a Zoom, an online webinar for you to explain how to apply and for you to get your questions answered. You can sign up for that at tax.ri.gov. Second, every business that gets a check for the 2-week pause, including those that haven't yet applied but that are going to apply between now and Monday, is going to get 2 checks to cover you for the 3rd week. So, and the second check will automatically be mailed out to you by December 28th. So let me see if I can make this clear. If you've already applied for money for the 2-week pause, you will automatically get another check to cover you for the 3rd week of the pause. And it'll be half as much as you received in your first check. If you haven't already applied, apply now. You have until the end of the day on Monday. And you will get your check to cover you for 3 full weeks of your lost revenue. So I hope that's clear, and I can answer questions if not. I'm also extending the additional $200 weekly unemployment benefit to cover the 3rd week of the pause. Again, you don't need to do anything. It'll just come to you. It will be come to you in the same way that unemployment insurance is delivered to you, and any Rhode Islander who certifies for unemployment the week of December 13th will automatically get an extra $200. So although I know this is brutal to extend the pause for 1 more week, I'm also extending the economic relief to individuals. You'll all get an extra $200 for that week, and businesses will get another check, half as big as the first one, to cover you for the lost revenue of the additional week of the pause. I will say, with the extension of these programs, I think that what I've just announced is probably another $30 million of relief. I will have essentially allocated all of the federal stimulus monies that we have received from the federal government. It is my hope that the federal government or Congress passes another stimulus, which includes small businesses and individuals and rental assistance, and as soon as that comes, we will get that out the door. Okay, so now you may be wondering what happens after the pause. And because I want to give everyone an opportunity to plan, I'd like to share with you what that will look like. As I've said time and time again, we can't go from a pause to flipping the switch. It has to be a slow dial-up of our economy. By the way, as it gets colder and activities are moving indoors, it makes everything so much harder. So today, in addition to extending our pause for another week through December 20th, I'd like to talk to you about the restrictions that will go in place starting December 21st, and that will remain in place through the end of the year. And I'd ask you to please put that slide up on the screen. The slide on the screen before you shows what restrictions are in place now through the end of the pause, and what rules will look like after the pause lifts. Now, in many areas, there won't be any change, and those are the items that are listed in black. We want schools to remain open to in-person learning for as many students as possible. I want to give credit to a lot of superintendents and principals and teachers. A few weeks ago, I announced that high schools, if they wanted, could go virtual, and most didn't. Most didn't. They chose to stay in person or hybrid, and I want to thank you for that. Our kids are benefiting hugely. Every day a child can't go to school is a bad day for that child, and it's pretty incredible, all of you who've left your high schools open and just worked harder for the children. So anyway, schools, no change. We want as many kids in school in person as long as possible. Childcare, manufacturing, construction, and personal services, they're all open now, and they will continue to be open just as they are through the end of the year. Haircuts, barbers, nails, childcare, manufacturing, construction, all open as they are now through the end of the year. The current retail restrictions will remain the same also. It includes lower capacity limits for big box stores. And I would say, as a Rhode Islander and as your governor, please shop local if you can. Shop online and shop local. The big companies are doing just fine through COVID. The little guys are struggling. So if you're lucky enough to have the means to buy holiday gifts, I'm personally asking you to do all your shopping local. Keep the money in our economy. You can go to shoplocalrhodeisland.com and do all your shopping locally online through that website. Houses of worship are going to remain open at their current capacity through the end of the year. And I want to say thank you to the faith leaders. This is the big season, Christmas, Hanukkah, year-end celebrations. I realize it's incredibly valuable and proper to keep houses of worship open, and so we're going to do that. But I want to thank faith leaders because they've been working collaboratively with us, and they're going to make a number of adjustments over the Christmas and Hanukkah to make sure that people can worship in person but also do it safely. I would say I would also like to encourage folks to worship virtually whenever possible. Bar areas will remain closed with drinks served only to customers seated at tables. I know that's a tough one, and that's why we're putting more stimulus money out the door. The items in red in your screen are the areas in which we are slowly turning the dial back up after the pause. Beginning December 21st, restaurants are going to be allowed to slightly increase their capacity, but still only seating people together who are from the same household. The name of the game between now and the end of the year is stick with your household. Protect your household. Venues of assembly, gyms, indoor sporting facilities, recreational venues that are currently all closed now will be allowed to reopen December 21st, but with new restrictions. So for all of you who are struggling that you can't go to the gym, starting December 21st, they will again be open. There's a lot of detail behind each one of these announcements. I'm sure you have many questions. What about funerals? What about wakes? What about this? What about that? All the detailed regulations will be posted soon on reopeningri.com. We'll get that done. I'd like to see it done by the end of the week or by early next week. At the first press conference in the new year, which will be Thursday, January 7th, I'll address then how we'll begin the new year, and man, I really hope we're able to dial it up even more at that press conference. But I'm trying to provide some guidance now so we know how we're going to get through the rest of the year. So as I said, I've said a few times, there's a clear theme in all of the rules. Protect your household. Protect your household. I want you to think actively. Stop thinking so much about what you can't do and start thinking about what you are going to do to protect your household. The reality is, once one person in your house who you live with gets COVID, it's incredibly difficult, if not virtually impossible, to prevent spread throughout the household. But what you can do is make smart choices so you don't ever have anyone in the household to get COVID. So what does that mean? That means wear your mask all the time, anytime you're with people that you don't live with. If you don't, you're at greater risk and at greater risk of spreading. Don't have social gatherings with people outside of your household. Get tested often. We have, over the past few weeks, dramatically expanded the supply of testing. Tests are free. They are easier by the day to get. I want to say this. If you or someone in your household winds up in an emergency room, that's very expensive. It could be incredibly expensive for you. Getting sick can be very expensive. Getting a test is free and could save your household. Wearing a mask is free and could save your household. Thousands of people in Rhode Island have lost their loved ones. Don't let that be you. Go get tested. It's free and easy. You won't have to wait in line. And we'll get it done quickly for you. I guess, I don't know what it's like, wearing your seatbelt or something. Like, you can, with such a simple thing, one test can save your household from being in the hospital, losing a life, or huge financial risk if you have an expensive bill that comes from the healthcare system. On the topic of testing, as I said, we've really increased our test. As of today, we have 5,500 daily tests reserved for Rhode Islanders with symptoms through portal.ri.gov. A few weeks ago, I said that by today, I wanted to be at 3,000. We are way past that, and we're continuing to bring in more testing. So if you feel sick, you know, we've talked here at this press conference, people don't know how to get a test, people can't afford to get a test, some of the private labs, unfortunately, are really gouging people. Just go to portal.ri.gov, portal.ri.gov. It is free, it is easy, you schedule it yourself, we'll get you the results quickly, we'll shoot you a text quickly. If you feel sick, go get a test. If you don't feel sick, go get a test. We want to test as many people as possible. We've also added more testing in the Dunkin' Donuts Center for people who aren't sick. We're using the new Binax Now tests, no equipment, very easy, it's simple, you'll know within 15 minutes. My goal is by next week to be doing 5,000 tests a day just at the Dunk. So I also want to remind you that, you know, things are a lot better now than they even were a month ago with testing, which is why I'm going over this. You can now review your own test online. You'll get a text, you'll be told your results are ready. You can go online yourself and get the results of your test. Since launching the texting service, which just about 2 weeks ago, we've sent over 200,000 text messages. So I can't say it enough. Go get tested, go get tested, go get tested. Let's say you did hang out with people over the weekend that weren't in your household, which you shouldn't have done, but if you did, go get tested. If you feel a little under the weather, go get tested. If you're just worried, you know, you've got someone older or compromised in your life, go get tested. Sign up on your own, portal.ri.gov. It's free, it's easy. We'll shoot you a text, we'll tell you your results are ready. You can go online, get your own results. If you're positive, immediately isolate. Go home, shut your bedroom door, and avoid folks in your life and have people in your household go get tested. We will get in touch with you and see if you need a hand. Do you need a hand with food? Do you need a hand with health care? Do you need a place to live? You know, maybe you live in a crowded household. We'll help get you a hotel. And I also want you to tell everyone you've come into contact with. Call your friends, text your friends, and say, hey, I just was tested positive, so they know immediately, so they can go get tested and they can quarantine. It's on us now. It's on each and every one of us. The government can't do everything. You have to take control. So go get yourself tested, protect your family, protect your household, protect your friends. Do what it takes to protect your household. I want to take a minute to talk about schools. One of the successes of our ability to keep so many kids in school is that we're the only state in America that has set up a separate K through 12 testing system, which is working incredibly well. Like, we're seeing very low positivity rates in the K through 12 testing system. At a testing event at Ella Risk Elementary School in Central Falls last week, Central Falls, like the highest percent positivity of any city in Rhode Island. At that test in Central Falls, we ran 182 tests and found a test positivity rate of 1.6%, extremely low. At the Racy's Dual Language Academy, we tested 72 students and found 0 positive cases. So K through 12 continues, it's safe to send your kids to school. The testing is going well, and the data from that test positivity shows low numbers. But it also means we have to test more. And I want to give teachers peace of mind, and students and parents peace of mind. So we're going to continue to test more. Over the next week and a half, we're going to be doing similar testing events at schools in Providence, Lincoln, and South Kingstown. And because this pilot has been so successful, we're going to launch it statewide in January. Statewide in January. Starting in early January, we will be offering on-site asymptomatic testing to any school district that wants it. So just testing of a whole entire school, whether they feel sick or not, on site, starting in January, which I hope is evidence to teachers how much we care, and evidence to our kids and parents how much we care. Testing is key, and so starting in January, every district will have the ability to do testing of everyone on site. That's not going to replace the K through 12 testing system. It's in addition to that, so we can detect cases quickly. In the meantime, we've also made K-12 testing accessible through portal.ri.gov. Before, teachers and students scheduling a test through the K-12 system had to call the hotline. Now you can still call the hotline if that's easier for you, or you can just sign up at portal.ri.gov. This is confusing. It's sometimes confusing for me, so I'm trying to simplify it. If you remember nothing else, go get tested, portal.ri.gov. If you're already used to using the K through 12 hotline, keep using that, and that'll be fine. I would like to take a minute to thank our school leaders and teachers for the incredible, heroic work that they are doing. It's every day a child is out of school is a problem for that child. And to those children who are already struggling for whatever reason, it's doubly so. We've tried to do everything that we can. We have a statewide pool of substitute teachers. We have over 6,000 HEPA filters now being delivered to classrooms. We're going to have testing available on site at every school in every district in January. I'm doing everything I know how to do to keep these kids in school. Teachers are working their tails off to keep these kids safe and in school. Same with principals and superintendents. I want to say thank you. To those of you who are throwing in the towel on our kids and going virtual, I think it's a shame. I really do. You're letting the children down, and I don't see any reason for it. So I'd ask you to rethink it. The statistics that are coming in around the harm to our children of being out of school are heartbreaking. Suicidal ideation among kids is through the roof. Bradley Hospital's overrun. Hasbro ER is overrun. Children are isolated. Children are falling behind. Children are scared. Children who are intellectually, they are struggling. So this isn't easy. I am not saying this is easy. I will do anything you need to help you do the right thing, which is to keep these kids in school. Every day matters. So to those of you who are bending over backwards to keep as many kids in school as long as possible, I think you're heroic, and we're going to do more and more. And to the superintendents out there who've just decided to go virtual, I want you to look yourself in the mirror and ask if you can try a little harder, because I think the kids deserve better. To end on a happy note, tonight is the first night of Hanukkah, and I know Hanukkah is not going to be the way you would want it to be this year. It joins a long list of holidays this year that we can't celebrate the way we would like to. I think most of us can't wait until 2020 is over. So I'm sorry that you can't gather in person the way that you want to do. I'm sorry you can't all gather in the kitchen and make your latkes and together light your menorah. But I'm asking you to celebrate with your household and virtually if you can. You know, get folks together virtually, call your loved ones. Next year will be different, and this year I'm asking you to celebrate safely and creatively. I will say that the Hanukkah story is one that really resonates now. It's one that resonates now. It's a story of community, and it's a story of light, and light prevailing over darkness. This has been a dark year. 2020 has been a dark year. It's been the hardest year of your life for a lot of people. If you lost a loved one, if you lost your job, if you're about to lose your business, there's a lot of darkness. There's a lot of darkness. But in that darkness, we have to find the light. And that is what the celebration of Hanukkah is all about. And we have to find our strength, and we have to know we're going to get through it. And that I do know. That I do know. And I know the people of Rhode Island are strong and resilient, and I know that the light at the end of the tunnel is quite close now. I know that because the vaccine is on its way. It's going to be arriving in Rhode Island in the next week, and we have a really good plan to get it out to everyone. So as we end the year, and as our Jewish friends begin tonight to celebrate Hanukkah, I would just say, let's all try to find some light to sustain us and hold on to hope as we get through these last few months of coronavirus. So I wish you a very happy Hanukkah. I wish you a happy Hanukkah, and I hope you're able to celebrate creatively with your loved ones.